Mr. Speaker, I'm again here late at night to bring the government in to bring common sense solutions to offer them. Now, Mr. Speaker, we hear every day that our healthcare system is stretched thin. And across the 34 communities in my riding of Courtenay-Alberni, too many people are already struggling to find a family doctor, and we should be reducing pressure on the system, not adding to it. Yet the federal disability tax credit process continues to do exactly that. Family doctors are spending hours on Government of Canada paperwork when they could be actually instead seeing their patients. The College of Family Physicians of Canada has been clear. In 2022, roughly 250,000 disability tax credit forms consumed about 250,000 hours of physician time, the equivalent of 1 million lost patient visits. That is 1 million appointments that could have been gone to actually giving Canadians the care they need. There's also another side to this problem. Across the country, many people who already qualify for disability supports, whether it be in their province or territory, can't actually access the disability tax credit, not because they're ineligible, but because they can't actually find a doctor to complete the form. So no doctor means no form, and no form means no access. As a result, people are being shut out of both the disability tax credit and the disability benefit that depends on getting the disability tax creded, Mr. Speaker, because the benefit that they're actually trying to get is just modest. It's about $200 a month, Mr. Speaker, but it actually can make a huge difference in someone who's living on disability's lives. It can be the difference between getting by and falling even further behind. So instead of actually removing barriers, the government is maintaining them. So we're also learning from public servants at the Canada Revenue Agency who are dealing with the burdensome and duplicative process that I identified, that they're actually repeating the work that provinces and territories have actually already done. So while a growing backlog of applications leaves Canadians waiting, this isn't just inefficient, it's actually deeply frustrating for the staff and the doctors and healthcare workers who are trying to help the people navigate the system to actually get this done. So, Mr. Speaker, you've heard me. I've been raising this issue for years. Tonight, I'm responding to a question I first asked again in December, and this question still has not improved the situation. Budget 2025, though, Mr. Speaker, it sets aside $10 million. So get this, Mr. Speaker, so that applicants can actually pay a $150 fee to navigate the same broken process. Instead of fixing the system, the Liberal government is asking people to pay to get through it. It's just not okay, Mr. Speaker. This is not a solution. Canadians deserve to know why these barriers remain, and when eligible people can't access supports, it raises serious ethical questions about whether the complexity is actually being used to limit access and make life harder rather than improve outcomes. That's why I introduced Bill C-211, making it easier for people with disabilities to access the benefits they're entitled to while reducing the paperwork burden on healthcare workers. Right now, Canadians are forced to prove the same disability over and over again across different levels of government. My bill would streamline the process so that when a disability is recognized by a province or territory, it's automatically recognized federally. This is a practical, common sense fix. It would reduce barriers, improve access to benefits, and free up doctors to focus on patient care. It would also ensure that people aren't excluded simply because they can't access a physician to complete their paperwork. So, Mr. Speaker, Canadians deserve a system that works. New Democrats will continue to put forward practical solutions that relieve pressure on our healthcare system, respect healthcare workers, and ensure supports reach the very people who need them the most. It's time to fix the disability tax credit process once and for all. Thank you.
The Honourable Parliamentary Secretary, the Minister of Health.
Thank you, Mr. Speaker. The member for Courtenay-Alberni correctly notes that provinces already determine eligibility for their respective programs, including those based on disability. And he is asking why the minister will not accept provincial approval to reduce barriers to obtaining the disability tax credit. It's not about red tape, Mr. Speaker. The Canada Disability Benefits provides up to $2,400 per year to low-income persons with disabilities between the ages of 18 and 64 who are eligible for the disability tax credit, among other criteria. The amount is indexed to inflation and will be adjusted each July to reflect cost of living increases. This benefit was identified as a priority for the disability community because although provinces and territories play a critical role in providing supports and services to Canadians with disabilities, those programs vary widely in objective, design, scope, and amount. Our benefit was always intended to supplement, not replace, existing provincial and territorial income support measures. And that's because our priority is to ensure equal access to support for persons with disabilities, regardless of where they live in this country. We deliberately chose to base the eligibility criteria on the disability tax credit rather than provincial and territorial benefits to avoid creating disparities where a person qualified for the benefit in one province or territory but not in another. We wanted all Canadians to have equal access to federal support in addition to support they receive from provinces and territories. Basing disability eligibility on the disability tax credit ensures the Canada Disability Benefit is delivered in a consistent and equal way across Canada. We recognize navigating these benefits and their requirements can be challenging, so we have made improvements. In Budget 2025, we announced our intention to offset the cost of applying for the disability tax credit. New payments of $150 will be made to current, past, and future Canada Disability Benefit recipients to help offset costs associated with applying for the disability tax credit. The payments are expected to be paid before the end of 2026 to 27. Additionally, the 2024 federal budget committed funding to support not-for-profit community-based organizations. This will help connect persons with disabilities in accessible and culturally appropriate ways to federal, provincial, territorial, and/or local benefits that could assist them. This will also include the Canada Disability Benefit and the Disability Tax Credit. Currently, 14 community-based organizations are receiving funding to help address barriers and increase take-up of benefits. Mr. Speaker, there are a few ways in which we are supporting Canadians with disabilities by supporting their financial security. Thank you very much.
Member for Courtenay-Alberni.
Mr. Speaker, even though this is federal, clearly this Liberal government doesn't see that this is their issue. During COVID, governments moved quickly. We cut red tape, trusted existing systems, and delivered support when Canadians needed it most. We need that same urgency now. Today, doctors are losing valuable time to paperwork instead of seeing patients. People who qualify for the disability tax credit and the Canada Disability Benefit can't access the supports they need because they can't find a doctor to complete the form. Meanwhile, public servants are stuck managing a duplicative process and growing backlogs. And when resources are scarce, every hour matters and every barrier matters. Provinces already assess eligibility. The government needs to recognize that and act. Stop the duplication, free up doctors, support people, let public servants do their job. Why won't this Liberal government act now and take this issue seriously?
The Honourable Parliamentary Secretary to the Minister of Health.
Mr. Speaker, I thank the member opposite for his advocacy on behalf of Canadians with disabilities, and I really respect his work on this. He really works tirelessly, so I look forward to working with you on this. And I appreciate the opportunity to remind colleagues that we are working to support persons with disabilities struggling with higher cost of living. The Canada Disability Benefit is one part of a system of supports guided by the principle that inclusion is the foundation of a strong and resilient society. This is important work, as my colleague has noted. The government will continue engaging with provinces and territories to ensure Canada Disability Benefit recipients are better off because of the benefit. Our program highlights the federal government's commitment to building a more affordable and inclusive Canada. Thank you, Mr. Speaker.